All right, everybody, we are going to go into our last lightning round TED Talk solution-oriented session with a distinguished panel who I will now introduce. Well, our first presentation is going to come from two fantastic young scholars in the drug policy realm, Khalid El-Sabawi and Jennifer Oliva. Khalid is an assistant professor at Elon University and a scholar with the Addiction and Public Policy Initiative at the O'Neill Institute. Dr. El-Sabawi is an interdisciplinary scholar with a JD from the University of Texas School of Law and a PhD from the Ohio State University. You got to take the D or they come after you sometimes. Jen is the associate dean for faculty research and development and the director of the Center for Health and Pharmaceutical Law at Seton Hall, where she specializes in health law and policy, FDA law, drug policy, privacy law, evidence, and complex litigation. She also wrote a chapter in our COVID-19 legal assessment this year, so she's always a little spare time for good cause. She also serves as a senior scholar with the O'Neill Institute for National and Global Health Law at Georgetown and the National Pain Advocacy Center's Science and Policy Advisory Council. So let's start with you two. A clock will soon start ticking.
So today we are presenting on the new drug war. Sorry. Since the 1800s, American policymakers have waged a racist, costly, and punitive drug war that has cast some drug use as simple behavior, and those engaged in it as deviant criminals. The war on drugs has been defined by a focus on controlling the supply of drugs and that are labeled dangerous and addictive. The decisions as to which drugs fall into these categories are made by law enforcement agencies, not by health agencies. And they're not made based on scientific evidence. This drug war has been a failure on all counts. Since 1971, it's cost American taxpayers trillions of dollars. And in 2021, the U.S. still experienced the highest rate of overdose deaths in the nation's history. So not only has it been costly and ineffective at reducing the harm caused by chaotic substance use, the drug war has been used as a tool to disenfranchise and incarcerate generations of Black Americans. Black Americans are nearly 6 times more likely to be incarcerated for drug-related offenses than their white counterparts, notwithstanding the substance use rates are comparable across the population. Now, admittedly, the rhetoric that drives the drug war has changed in recent years, with policymakers at least purporting to adopt a health-oriented approach or health-oriented language in describing the opioid crisis. Now, this in part was because of whitewashing of the ongoing drug overdose crisis. But the public should not be fooled by this public health rhetoric. The war on drugs has not ended. It has merely been retooled, recalibrated, and reframed. New proposals to address the opioid crisis may appear more public health oriented, and we can see that some of the initiatives are. But alongside the highly publicized public health approach is an insidious re-entrenchment of the punitive approach to addressing chaotic substance use. In this presentation today, we will provide 3 illustrated examples of recent policy proposals that have enhanced surveillance, made it easier to charge persons with drug-induced homicide, and bolster the civil penalties associated with substance use.
Thanks so much. So I'm going to start out with enhanced surveillance, which is what I've been focused on in the last year. And as my partner here just said, despite the new, public health harm reduction language that policymakers and law enforcement now uses frequently to discuss drug use, which is used largely due to the whitewashing of the current polypharmacy overdose crisis, legislators and law enforcement have significantly enhanced prescription drug surveillance. And in so doing, have exacerbated the crisis and enhanced poor health outcomes. The first wave of our crisis, which people, if you look at the charts, usually sort of chalk up to starting around 1999, is frequently attributed, right, to this, you've heard this narrative, mass overprescribing of OxyContin, which the FDA approved to treat chronic pain in 1995. Several things occurred during this so-called first wave. First, prescription opioids are widely demonized due to escalating overdose deaths. Second, the DEA and DOJ began investigating and prosecuting prescribers and dispensers for opioid-related practices. And most importantly, from my perspective, to aid in that effort, the DEA provided significant funding and resources to the states to develop prescription drug monitoring programs, which I'll refer to frequently as PDMPs. Third, and naturally, in response to this heightened law enforcement surveillance, prescribers began to get out of the pain management business. Pharmacists were turned into, as Liz Chiarello says, the slew, many law enforcement officers. And we saw a significant limitation of the amount of opioids that were prescribed and dispensed. This would take us to wave 2 of this crisis, which is a 3-year period between 2010 and 2013, where we see prescription drug overdose deaths begin to stabilize, but a rise in heroin poisoning fatalities. All right, and then we move to our current state of affairs, which seems to just get worse every year, which is a polypharmacy, illicit-driven sort of fentanyl situation. Okay, what we see across all 3 waves of the crisis is the illicit drug market behaving consistent with what drug researchers call the iron law of prohibition. Right, Richard Cohen coined this term in 1986. It stands for the proposition that as law enforcement becomes more intense, the potency of the prohibited substances increases. Cohen himself puts it this way: the harder the enforcement, the harder the drug. Heroin's much more potent than prescription opioids, fentanyls upwards of 50 times more powerful than heroin. We witnessed a similar dynamic during alcohol prohibition, where many Americans switched their beverage of choice from cider for breakfast and beer to high-proof spirits and cocktails. The difference between the law enforcement crackdown on alcohol during prohibition and today's supply-side surveillance tactics are that today's tactics are purportedly more sophisticated and accurate and objective, right? Because that's because they use artificial intelligence software platforms driven by algorithms that risk score patients, prescribers, and dispensers to ferret out pill mills, overprescribing, dispensing, drug misuse. We'll argue in our article that these new automated surveillance systems, which have been adopted in all 50 states now, Missouri just did it this summer, and DC, are arbitrary, discriminatory, and health harming. As such, and notwithstanding, again, the new language of the drug war, law enforcement prescription drug surveillance is at an all-time high and has driven particularly disastrous results. Which my picture here, if you want to just Google it, is NPR, Kaiser Health. A few people ran this story this week about pharmacies closing down that were prescribing buprenorphine, which is one of the 2 drugs that's predominantly used to treat opioid use disorder, because they were being surveilled by the DEA and they were red flagged as over dispensers. That story just came out 2 days ago.
All right, so moving on to our second example. DrugInduced homicide. So in 2016, the North Carolina legislature enacted arguably some of the most advanced harm reduction laws with their robust syringe service program legislation. Now, that advocates at least a public health approach to the overdose crisis. Then 2 years later, that same legislature enacted legislation to make it easier for prosecutors to charge individuals with homicide for providing drugs that resulted in an overdose, recommitting itself to a punitive criminal legal approach, despite the opposition by public health advocates, arguing that such a law would actually increase overdose death rates. These so-called drug-induced homicide laws make it easier to charge someone for homicide, and while Good Samaritan laws might protect someone who calls 911 to report an overdose from prosecution for things like possession, most don't protect the caller from prosecution or from being arrested for charges for drug-induced homicide. In other words, drug-induced homicide laws are not evidence-based policies that decrease overdose death. In fact, recent qualitative evidence suggests that there's a chilling effect in communities where a person has been arrested for a drug-induced homicide charge. And harm reduction groups have reported getting an increased number of calls for naloxone to reverse overdoses because people are too afraid to call 911. Another study suggested that arrest of persons who deal with drugs actually increases overdose death rates in the area that was once served, because that arrest creates a hole in the market, which is quickly filled by a new person with a new and unfamiliar supply. Actually, a known and trusted person who deals with drugs has been found to be a protective factor against overdose deaths. So not only are drug-induced homicide laws effective at decreasing overdose deaths, they continue the long-standing trend in U.S. drug policy of becoming yet another tool to lock up brown and black people. A study conducted by Professor Beletsky's Health and Justice Action Lab has found that previous criminal laws has found that black persons have been arrested and charged with drug-induced homicide laws at greater rates than white persons, suggesting that continued use of our criminal legal system is disproportionately affecting black and brown communities.
Okay, last but not least, and again, regardless of the public health rhetoric, even substance use disorder, there's been little abatement of the litany of civil collateral consequences that attend to individuals who use drugs, have a drug use disorder, or merely have a drug arrest or conviction for recreational drug use. Just 2 days ago, for example, the Biden administration refused to reconsider the federal rule that denies public housing benefits to individuals who use cannabis, even when those individuals are entirely in compliance with state law and are using cannabis pursuant to a legitimate medical prescription. In addition, civil law continues to create significant access to evidence-based substance use disorder treatment for individuals who are pregnant or postpartum. It is well accepted that opioid medication therapy is the gold standard treatment for pregnant individuals with opioid use disorder. It is preferable to medically supervised withdrawal, because withdrawal is associated with high relapse rates, which leads to worse outcomes. People who are pregnant and actively admit that they have an issue and seek evidence-based medication treatment, however, are often met with harsh civil penalties. Prosecutors have attempted to rely on a host of criminal laws in the books to attack prenatal substance use. The Supreme Courts of Alabama and South Carolina have upheld convictions ruling that substance use during pregnancy constitutes criminal child abuse. Meanwhile, many other states have expanded their civil child abuse and neglect laws to include prenatal substance use. As such, prenatal drug exposure can provide grounds for terminating parental rights or separating parents from their children. Some states also authorize civil commitment, such as the forced admission to an inpatient program. There's been even famous cases of women being shackled, handcuffs to beds, pregnant individuals who use drugs, under this rubric of protecting the fetus, right? More than half of the states require healthcare professionals to either report or test for prenatal drug exposure, which can be used as evidence against you in child custody proceedings later. It should also be noted that states must require healthcare providers to notify Child Protective Services when the provider cares for an infant allegedly affected by what illegal substances, if they want to remain eligible for federal child abuse prevention funds. Finally, several states have placed a priority on making drug treatment more readily available to women, again, under the guise of family-friendly, public health. These family-friendly programs, however, often place extravagant and onerous burdens on mothers by, for example, requiring them to live in a supervised facility, often separated from their other children, subjecting them to constant drug testing and other mandates. In addition, and quite ironically, although these programs are called family-friendly and they allegedly exist to protect children, they only supervise, detain, and surveil mothers with substance use disorder. Fathers who struggle with drug use disorders are rarely subject to such compulsory conditions in exchange for evidence-based treatment simply because they are parents. So in sum, these are just some examples. We're going to try to create a catalog here of here's what the rhetoric is, which she's an expert on, and then we're going to catalog just a litany of examples of how things either haven't changed or kind of like surreptitiously gotten worse in our contribution to the
Thank you very much. I was reminded of a conversation I had a couple of weeks ago with a drug treatment provider who was reporting that she and her colleagues are now getting people who come to them and describe themselves as fentanyl. They're no longer thinking of using heroin or they're just fentanyl users, and that's what they expect the drug market to consist of in the future. So, well, I'm sure people have questions and comments on that. But I'm going to move on to our next presentation. I also want to remind the panelists, please talking for the benefit of those out in the ether. We can hear you better if you do, but of course, feel free to keep it on if you prefer. So our next speaker is Beletsky, who is a professor of law at Health Sciences and the faculty director of the Health Injustice Action Lab. Professor Beletsky holds an interdisciplinary appointment with the School of Law and the Gaudier College of Health Sciences at Northeastern University. His experience is in the public health impacts of laws and their enforcement with special focus on infectious disease, substance use and addiction, occupational safety of first responders, and policing as a structural determinant of health, which he does internationally, not just here. His current scholarship examines municipal budgetary priorities, the role of police in COVID-19 response, the compounding of the overdose crisis by the global coronavirus pandemic, and how public health agencies shape individual liberties, especially in marginalized communities. More importantly, Neil is a graduate of this very law school, a frequent colleague and a great friend, and I'm delighted to have him here to give his quick version of some slice of this reality.
Thank you so much, Scott, and it's great to be back. This room is definitely giving me flashbacks. Shift Pro taught by Professor Burris. So, night sweats. I wanted to just briefly thank the organizers, Temple Law Review, especially Sarah and Bridget, for putting this together. It's obviously very timely topic, and also to acknowledge my co-authors on this paper, Jeremiah Gulka, Brendan Del Pozo, and Amanda Lattimore, who are my co-conspirators in the Health and Justice Action Lab, which is such a mouthful that, it was like,
Yeah, it just like totally threw me off.
Sorry. In addition to reimagining public safety, probably should reimagine the name that, no one can say really well. So our paper really focuses on the conversation around reimagining policing, reimagining public safety, to do that through a public health lens. What does that mean? I think that a lot of times that language is thrown around without too much substance, and as my previous co-panelists had mentioned, many times what is done under the banner of public health is not actually public health at all. So for example, drug-induced homicide prosecutions and laws oftentimes are billed as public health prevention. The way that legislators talk about these issues are, we're going to prevent overdoses by passing these more stringent laws, ratcheting up the penalties for fentanyl sales, drug-induced homicide, and so forth. So it's what my colleague Jeremiah Gulka had coined in a previous publication of ours is health washing. So you talk about whitewashing, there's health washing, there's greenwashing. So health washing is taking something that's not actually a health-based approach and saying it's a health-based approach and doing so without too much, if you do that really fast and you just, pose that rhetoric, people kind of tend to believe it, and it is not being flushed out. So our piece that we had proposed actually takes a critical approach to saying, what does it mean to be public health focused in reimagining policing and reimagining public safety? So the first thing that we propose is actually to focus on prevention. Prevention is really a pillar of public health, and this has been mentioned already in discussions earlier today. I think that prevention means, it means several things, but really the major contribution of public health to prevention science is to think about structural determinants. So thinking about what are the root causes, why are things happening, how can we take the information about what's going on and think about going upstream and addressing the root causes of the problems. It also means kind of discarding or walking away from the myopic focus on crisis response. We talked today about crisis response and the need for non-law enforcement approaches to crisis response. Absolutely critical. We also need to work towards not just focusing on problems when they've already unfolded, but thinking about how to prevent those problems from happening in the first place. Scott has written really persuasively a few years ago, like maybe 20 years ago, about the prevention paradox, which is really kind of a cognitive deficit that we all have about focusing on problems that are in front of us rather than thinking about problems that could occur. And this is really a huge bane for public health science. But in thinking about how to really address sort of policing and public safety, we need to think about prevention as a primary focus. Taking a public health approach also means effective measures and surveillance, and not surveillance from kind of a kind of myopic panopticon sort of perspective, but thinking about how to what gets measured gets done, and a lot of the statistical measurement and definition in public safety is really, really flawed. The data infrastructure in public safety is incredibly fragmented and inaccurate. And thinking about outcomes, measures and outcomes is really important. And public safety as a field needs to really re-examine the way that we measure outcomes. And things like crime rates, for example, or calls for service are not very effective measures of outcome. They're operational measures. In drug policy, we're really hampered by this because oftentimes our interventions to address drug problems are measured around things like number of arrests or drug seizures, which are really meaningless measures of public safety. That's not how we should be defining that. The third element that I wanted to highlight is the critical perspectives that public health offers in kind of thinking about its own work. I think that public health has a ways to go, but there has been a lot of grappling with the history of racism, of ineffective interventions, of over-surveillance. And so there's much more kind of self-reflection within the field of public health and in the field of public safety. And I think that's an important contribution that a public health approach can make to reimagining public safety, is this kind of internal critical lens. And that is something that also important to consider in terms of people using the public health rhetoric, saying, oh, we're taking a public health approach to something. That doesn't necessarily equate to it being humanistic or evidence-based, because again, public health in and of itself, like the Tuskegee incident, for example, was perpetrated by the U.S. Public Health Service. And so there's lots and lots of historical examples of incredibly harmful, racist and sort of authoritarian approaches. And so I think that just saying that something is public health does not make it necessarily benign or beneficial. And then finally, I wanted to just situate this discussion in the context, which I feel like has been also already mentioned, so maybe bringing those threads together, thinking about how this discussion interfaces with the societal discussion about defunding and abolishing police. And so, as myself and my colleagues who I'm collaborating on this project, we work a lot with the criminal legal system and trying to kind of improve it through training, through policy change, through interfacing between public health agencies and criminal legal agencies, policing especially. And so we grapple with the reality that these systems are incredibly harmful. But I think that a public health approach, and again, going back to this rhetoric of a public health approach, for us, what that means is the importance of harm reduction. So the importance of meeting systems as they currently exist and meeting the people who work in those systems where they're at and trying to move them along a continuum of harm reduction. So moving from more harm to less harm, and then into the realm of providing benefit. And if we can think about that, perhaps not in necessarily in conflict with the vision of abolitionists of imagining a world where policing and criminal legal systems are not necessary, but using that perhaps as a North Star. We believe that the road to this better world is paved with harm reduction, and harm reduction is really necessary. And I think that the best sort of contribution of public health is to think about how to reduce harm of these very toxic systems and lead to a better implementation and a better theorizing of what it means to be safe, who is safe, and to think about a holistic vision for community well-being. Thank you.
That close to mind, your comments called mine similar to Evan Anderson, who was here earlier, and I did early in the effort to sort of international effort to bring police and law enforcement people together to talk about how they might work together. And we used to talk about sort of the overlap between law enforcement and policing. And there are some ways in which they look at similar problems. But we came to realize, Evan and I, that really the better analogy, the better way to understand police these days is to think of them as like healthcare. And like healthcare in the US, we just say, first of all, way too expensive. Way too much money goes into that for the benefits you get out of it. The second thing is to remember they cause a lot of harm. So there's a huge amount of iatrogenesis, as the phrase goes. So that's another thing to think about. And then third, they do actually do preventive work. It's just a pretty small portion of what they do. And we're never going to be able to count on either the health system or the police system to really become sources of prevention. We're going to have to take that job out of their hands. And with that, I'm going to turn this over to another proud member of the short-haired policing policy research community, Jorge Camacho, who is a clinical lecturer in law and policing and the law policy director of the Justice Collaboratory at Yale Law School. I have to say we've got some great names for centers in this panel today. Prior to joining Yale, Jorge served as the senior counsel of the New York City Mayor's Office of Criminal Justice and as senior counsel in the Legal Counsel Division of the New York City Office of the Corporation Counsel. Jorge also served as an adjunct professor at St. John's University School of Law. He's a graduate of local Swarthmore College and Yale Law School.
Thank you, everyone. Take off my mask so you can hear me better. I'm here to talk about something that I think largely goes unaddressed, and it's not a very convenient truth, but it's one that I think we have to contend with. The more we start talking about what it means to reform police. Now, I want to make a distinction here before I get into my subject, which is I think there's a distinction to be made between police and policing. So when we're talking about policing, we're talking about a broader system that doesn't just mean the police. When we talk about policing, we're talking about public safety, we're talking about the mechanisms in place for promoting public safety, which obviously can include public health. It can include things like fighting the war on drugs or fighting against the war on drugs as a component, but it also includes police as a component. But when I'm talking about police reform, I'm really talking about the rank and file members in blue who work in police departments, who carry the authority to compel compliance with the law through the use of force. That's who I'm talking about. And this presentation focuses on what I think is kind of an unfortunate limitation of the police reform movement as it's been carried out really since the dawn of professionalized policing in the US. For those of you unfamiliar with the history of policing, policing, in the 1800s was really kind of a haphazard affair. It was very decentralized and it involved kind of the existence of these hyper-localized policing units that were really the subjects of local political bosses. And in response to that, especially at the turn of the century, There was a movement to professionalize policing, to say, okay, well, we need to centralize command. We need to have a single police chief or police commissioner who exerts authority over the entire police force. We need to get rid of the boss system that's in place right now. And we need to make policing a professionalized profession. Since the creation of that professionalized force over 100 years ago, the police reform movement has existed effectively. Police reform is as old as policing itself, or as police departments themselves. And the main mechanism for enacting or seeking that reform has been through policy. When we're talking about what to do with the police, how to fund them, what their responsibilities should be, we're really talking about policy, because all of these things get laid out ultimately in the laws, in the regulations that rule over police and police departments. But we've done so without acknowledging some pretty critical limitations of that approach. So if we're to measure the success of the police reform movement and the police reform mission by measuring how much policing and police themselves have changed since policing was professionalized, I think it's pretty clear that reform has largely failed. The police now are virtually identical to what they have been for the past century. The way they're organized, their mandate, the way we use them, and most importantly, the outcomes of their work on the street. Whether pursuing changes in individual practices like use of force or in larger structures like oversight, police policymaking has yielded few of the returns that have been sought by reformers. Continual failures of policy-based reforms have contributed not only to kind of serve as individual setbacks in that movement, but have also contributed to the steady calcification of police practice in the last century. A common thread across many, if not most, reform efforts, again, whether they target isolated policies or broader policy making, is that they leave policing's decision-making apparatus largely untouched. What do I mean by that? Well, when we're talking about their decision-making apparatus of police departments and police officers, we're talking about what they do on the ground and how it is they do it and how they determine that that is what they are going to do. So we're talking about not just whether someone is going to make an arrest or to use their discretion to issue a warning instead, but how many police officers are sent to the scene? How many police officers are sent to patrol an area? What types of resources are dedicated to support those patrols? All of those decisions are part of the day-to-day functioning of virtually every single police department in this country, and virtually all of those functions are left untouched by policy-based police reform initiatives. Operational decision-making directly informs the real-world experience for both officers and civilians, yet policy-based reforms haven't proven adequate to affect any kind of change in those areas. And this is a result, I believe, of an overemphasis on reform through policymaking rather than reform of decision-making. And although policy ostensibly governs the administration of policing operational apparatus, including patrol and enforcement and how that's conducted, policy-based reforms are blunted by the inherent limitations of policymaking itself. The problem isn't that policy-based reforms are necessarily ineffective. They certainly have a role to play in the reform movement. Instead, it's that they're necessarily limited in reach. This becomes evident when you examine what policymaking is and what it actually accomplishes versus what we hope for it to accomplish. At its core, policymaking is a top-level function that's largely divorced from operational administration. So to put it differently, to put it more simply, the cops who make the policy are not the cops who apply them in the field. This inhibits the translation of policy into practice, particularly where policies get filtered through multiple layers of bureaucratic layers before reaching the cops who are subject to them. Additionally, police policymaking is limited by the nature of police themselves. The business of being a police officer, the business of policing as a police officer, demands wide latitude and flexibility, resulting in policies that leave significant room for interpretation and discretion. Further, policing policies are often more precatory than prescriptive, which is to say that they offer guidance on goals to be attained or outcomes to be avoided, while leaving the manner of attainment or avoidance to be decided by patrol officers and their field supervisors. Finally, a trove of important decision-making occurs outside the realm of formal policymaking entirely. Decisions concerning enforcement priorities and tactics, resource allocation, patrol assignment, and dispatch are made outside of the policymaking processes of police departments. Accordingly, even when there's robust oversight mechanisms in place over those processes, important aspects of policing's operations can remain completely ineffective. So then, what is to be done? I have 3 prescriptions. First, we have to take stock of the most critical areas of decision-making that remain out of reach of policy-based prescriptions. Second, we have to ensure that reform efforts account for this decision-making. And third, we have to enact robust changes that precisely target that decision-making. By taking stock of police decision-making, we reveal a whole host of new potential touchpoints for reform efforts, including decision-making over determination of enforcement priorities, deployment of policing resources, and identification of crime drivers and responses to them. Ensuring that reform efforts account for decision-making in these and other areas could generate more robust reform platforms that impact real-world police practices, like those relating to discretionary enforcement and arrest, tactical deployment of field resource allocation, and overall police service delivery. Finally, enacting changes that target and transform this decision-making can help yield returns along some of policing's most intractable metrics, including morbidity outcomes rooted in disparity and inequality, community perceptions of safety and police efficacy, and overall satisfaction with police service delivery. Thank you.
What's powerful. We need to know that operational judgment eats policy for lunch. When policies fail, we have PowerPoint slide trainings to remind people that they should follow the policy, and yet often don't seem to work. So I hope that in your collaboratory, you'll be continuing to explore this largely unexplored area, how we actually move the policy transformation process to actual change in what people do in their jobs. Always the hard part about criminology from the start, changing actual police behavior. Okay, we are now reaching the point of our final pair of presenters. I'm very happy to welcome and introduce to Temple Councilmember Jamie R. Gauthier, born and raised West Philadelphian, was elected to the 3rd Councilmanic District in November of 2019, just in time for COVID. With 2 decades of experience fighting for fairness, equality, and justice in neighborhoods in this city, Councilmember Gauthier brings a depth of knowledge related to community and economic development, grassroots engagement, and nonprofit administration to our conversation. In her prior role at Local Initiative Support Corporation, Councilmember Gauthier helped develop affordable housing across Philadelphia. God knows we need it, and participated in a variety of economic development projects. She's joined by another Temple grad. Kirby Gaherty is a program manager for justice reform and youth engagement at the National League of Cities. Before working at NLC, Kirby worked for the City of Philadelphia and the Center for Family Services. So please take it away. And as I mentioned before, please feel free to take off your mask if you're comfortable so they can hear you on the internet.
Okay, good afternoon. As already stated, my name is Kirby Gaherty, and I'm a program manager for justice initiatives at the National League of Cities and the Institute for Youth Education and Families. As you heard earlier from some of my colleagues on the panel, NLC is a membership organization that supports cities, towns, and villages across the country, and the main goal is to support local leaders and improving the quality of life for their constituents. In my role, I support our work as a strategic ally with the MacArthur Foundation Safety and Justice Challenge. And while that generally involves working on jail reduction strategies with cities, in the summer of 2020, we were given some flexibility in the way we could work. And we decided to come together as an organization to better support city leaders in efforts to reimagine public safety. The murders of George Floyd, Breonna Taylor, Elijah McClain, and too many more to name, unfortunately, really springboarded more collective action in our organization. And we decided to convene a group of local elected officials to think more deeply about what cities can do to move toward new visions of safety that are less police-centric and really zero in on health approaches, a better balance in what and who can constitute safety, and authentic and equitable community engagement. That group was called the Reimagining Public Safety Task Force. And you can see here that they developed three main goals. One of the major ones really to amplify the voices of local leaders in justice reform and public safety. So from January 2021 to August 2021, the task force met and held listening sessions centered in the areas listed here, and those were all recorded if anyone has an interest in watching them. They're on our website. And as was the case with previous task forces within our organization, the goal was really to come together around actionable, practical recommendations that city leaders can utilize to move the needle on a local level. Oftentimes, for cities, when it comes to justice reform, things like courts and jails and other county-based systems are where a lot of the reforms are happening. But in this case, as Marissa set up perfectly earlier, we saw a lot of city action happening that hadn't happened before and things that they could control, including policing. So we want to really capitalize that, and that's where our focus remained. The task force was made up of over 20 mayors and council members, involved in the collaboration of the Gauthier Institute of Justice, Cities United, John Jay College, and the Urban Institute. You can see our membership here. It was co-chaired by Mayor Ross Baraka of Newark, New Jersey, and Mayor David Holtz of Oklahoma City. They represented two very different perspectives on the topic and cities at different points across this continuum of transforming local justice systems. But each of the members of the group really played a role and had a desire to make some sort of change, which was a helpful step. And if we're talking about amplifying city voices, my voice is not the most relevant one in this moment. So I'm going to hand it over to one of our task force members to talk more about the recommendations and city leadership in reimagining public safety. Councilmember Gauthier was an integral part of the task force and has been really vocal about her desire to see change, and we appreciate her being with us here today.
Thank you so much, Kirby, and thanks to you all for the opportunity to be here today. I'm Councilmember Gaudier, and I represent Philadelphia's 3rd Councilman District, which includes much of West and Southwest Philadelphia. As many of you here might know, West Philadelphia was an epicenter of unrest in 2020, both in the wake of George Floyd's murder, and then again, just a few months after the killing of Walter Wallace Jr. Walter was my constituent. He died in the midst of a mental health crisis. Police shot him to death less than 1 minute after they arrived on the scene in front of his mother and his neighbors. Last year, my constituents, along with people throughout Philadelphia and across our country as a whole, basically said that enough was enough. And they took to the streets. And, you know, I think what people were saying then and what they're saying now is that we need accountability from police. We need justice for Walter Wallace Jr. and George Floyd and for all of the other undeserving Black men and women who came before them, who died prematurely at the hands of police. And furthermore, we need justice for the Black and brown communities that are being terrorized day in and day out by gun violence. The communities that I represent have been absolutely devastated by a dramatic spike in gun violence over the past 2 years or so. And, you know, I just want folks to think about what what that means. Having to be hyper vigilant every time that you leave your house, feeling afraid to let your kids play outside, feeling like you're trapped inside your home. It's trauma, and it's no way for anyone to have to live. But Black and brown neighborhoods have been struggling with this type of violence, with a spike in it over the past 2 years, but with this type of violence for a very long time. And so it's an understatement to say that Black people in Philadelphia are exhausted. And, you know, they're seeing the same set of dynamics play out over and over again. And so that's why it was very deeply important for me to join the National League of Cities Task Force on Reimagining Public Safety, because all of the issues and the topics that we were talking about hit incredibly close to home for me and my constituents in my city. Next slide. So as Kirby mentioned earlier, over several months, the Reimagining Public Safety Task Force held meetings and listening sessions to investigate best practices from around the country when it comes to building a more equitable vision of public safety. And so I wanted to offer a very high-level overview of the recommendations that came out of our work on the task force. All of these recommendations are shared in this final report called A Path Towards Safe and Equitable Cities, which you can find on the NLC website. Our first recommendation is to direct municipal government leadership toward providing safety and well-being for all. And that sounds incredibly simple and straightforward, but if it were put into practice, it would be a significant shift for virtually every municipality in this country. It's time for us to think beyond policing and arrest and jail as the only way to define and achieve public safety. And so this recommendation challenges city leaders to take a much broader look at what safety means for our residents and how safety can be viewed through a lens of public health and holistic well-being. And so this could include factors like housing and living conditions, physical and mental health, access to quality education and jobs, and environmental justice. These are all part and parcel of what makes the city safer. And indeed, if you look at the Black and brown neighborhoods across our city that are suffering from gun violence, they're the same neighborhoods that have been suffering from a lack of investment in all of these areas for many decades. And so if we begin to measure success via these factors, we can better address the comprehensive needs of our residents, and in doing so, build safer and more equitable communities. Our second recommendation is to balance the respective roles of government agencies, residents, and partners. It's absolutely critical that we move beyond the traditional stakeholders in conversations around public safety. And a key part of this work is involving community members in every step of the process. Right now, in all ways, cities should focus on centering the voices of Black and brown residents, and in particular, youth and young adults who most often face the harms of our current public safety system. And in addition to engaging community, this recommendation is also about providing some balance related to funding and to budgets. A city's budget is a reflection of its morals and its values, and it should also reflect the priorities of our residents. And this is all in pursuit of achieving a very balanced approach and a fuller approach to public safety. Our third recommendation is to significantly expand the use of civilian-led and community-based strategies around violence prevention and well-being. Walter Wallace Jr.'s death was a perfect example of the fact that we need many more options for non-police response to 911 calls for mental health crises. And in addition to community responder models, there are a variety of methods and programs that city leaders can adopt in order to change the way that they respond to calls for service and to utilize a more compassionate, health-centered approach. I'd like to highlight just a few of these models. There's the co-responder model where police are paired with clinicians to respond to mental health calls. There's a pilot co-responder program underway in Philadelphia right now. And then we also are piloting the build out of mobile crisis units that don't include police at all, and that are made up of peer specialists and clinicians to respond to mental health calls. Another model that Philly uses is violence interruption, in which credible messengers are dispatched to de-escalate and intervene in conflicts between individuals who are most likely to shoot and be shot. And so we're using this approach here in Philadelphia and also planning to expand the approach to respond to dramatic increases in gun violence in neighborhoods across the city. The fourth recommendation from the task force is to embrace full and transparent oversight and accountability for law enforcement. While the task force decided not to censure police or law enforcement in our work, we did want to be sure to acknowledge the role of city leaders and in particular mayors to ensure that there are oversight, transparency, and accountability measures in place for police officers. Through efforts like transparent data sharing, community-driven training for officers, civilian oversight boards, and stronger work with unions on collective bargaining, local leaders can get a stronger handle on how the police interact with the public. And I also think that our efforts in this area in police reform and transparency will help us in our effort to address the gun violence crisis as well. And last but not least, the fifth recommendation is to seek guidance and support from peers and experts with the assistance of NLP. As elected officials, we face a great deal of scrutiny on a daily basis, and we need to balance the opinions and demands of our constituents with those of other local stakeholders. And because of this, support from other city leaders is a key aspect of the work to reimagine public safety. We have so much to learn from one another about what's working and where there's room for growth. And I think this was one of my favorite parts about participating on the task force. It's crucial that we're able to support one another in this work and maintain access to resources and ideas that can help all of us along the path to progress. Next slide. And so in closing, I'd just like to emphasize that just because we've seen increases in gun violence both here in Philly and across the country, that's not an excuse to go back to a law and order mentality in our cities or to prioritize punishment-driven methods to achieve safety. Now more than ever, we need cities to look at health-driven, harm-reducing, and community-centered programs and policies to make all of our residents truly feel safe. Early next week, NLP will be releasing a supplemental toolkit connected to this work that really digs into how cities can operationalize the recommendations from our task force so leaders from around the country can leverage the work that we did. And so with that, I'll again say thank you to Kirby for everything that you've done to make these efforts possible. And thank you all for your interest in this vital work.
Well, we have some time if you have questions, reactions, more ideas to add to the mix. Please raise your hand and we'll bring you a mic. Anything from the web group? Well, I think it's been, I think it's a pretty comprehensive set of solutions. Okay, we got back there, Dawn, and then Bennett.
Thank you for the presentation. This is on the last one. In the framework, in step 2, where it was defining the roles and responsibilities of council members and community members, et cetera. I'm sure there's more detail in the actual toolkit, but I'm curious about who's defining the role of the community member. How does that come about? Who's defining these roles that people have in this new framework?
Well, I think it's important that community members be the center of all of this, right? I greatly believe that people understand
what's going on in their communities and they understand the solutions as well. And so in my mind, they are at the center, and we're taking our cues from like a policy making and budgeting perspective from community.
Ben?
Everybody, great panel. This is a question for Leo. Just wanted to, if you could expound a little bit, around your using the framework of harm reduction as like public health, sort of almost running interference for law enforcement, and the idea of, is it better to have a seat at the table to help minimize the harms of the criminal justice system, rather than stepping back and not participating and having sort of clean hands, so to speak? And just wondering sort of if you feel like, how did you come to the, like, your position that you feel like it's better to have a seat at the table? It sort of seems like the stance you took. And if that in any way facilitates the health washing that you were talking about, or sort of how ways to minimize the health washing while also having a seat at the table. Where you take that?
Yeah, it's a great question, and I think that I'm not sure that I have, a definitive answer other than to say that harm reduction focuses on an empirical assessment of how things currently are and identifying specific elements of harm, and then trying to target those elements of harm to reduce harm and improve benefit. And I think that given the current multi-level toxicity of these systems, a hands-off approach is, although ideologically pure, is not empirically based. And so I think that your point is well taken in the sense that is public health sort of providing coverage and credence to punitive approaches and harmful systems by engaging with them. And I think that it's important to be deliberate in use of language, for example, using partnership to describe the interfacing between public health and policing or other criminal legal systems. I think that language should be something that we discard, and we should talk about interfacing or interacting, because these systems currently do interact. And as things currently stand, many people experience contact with the system, and to simply say, we're going to work towards abolishing the system is, again, it's not based on sort of empirical assessment of where things are. And I think it's also, this implicates the reality that a lot of the work that's being done to shrink the footprint of the system, it's really one step forward, two steps back. So I don't think that that work is going to be, very, it's certainly not happening tomorrow, and maybe it won't ever happen. And that's where I think having a vision of a more safe and just world without these punitive systems may be a useful North Star, but it isn't something that we can accomplish anytime soon. And since the harm is happening today, we have to, again, meet the world where it is and not where it should be.
There's been a lot of comments about community involvement, engaging in particular communities that are most impacted by these public health and policing strategies. So the question is, how do you address those parts of the community that have been identified as those that are most impacted negatively by policies and strategies that we've been using lately and previously? Sometimes people feel so disaffected, feel so cynical that they don't even want to spend the energy to participate in yet another program that they have a reason to expect ultimately benefit them. And at the same time, how do you address that part of the community of people that feel they are not part of the marginalized groups that are most negatively impacted? And so the issues and problems are far enough away from their lives that they really don't have to worry about.
You have to have strategies for both. One, I think, in this moment, we should almost be blanketing our communities that are being impacted by gun violence with services and with resources, right? And so I think it takes time, and I think it takes a robust level of investment in things like trauma services for people who are directly impacted by gun violence, but also trauma services for people who live in neighborhoods where there's constant gunfire, whether they're a direct victim or not. I think we should be using more of a credible messenger strategy and finding the folks that, you know, if I, Councilmember Gaudier, can't talk to folks and bring them to the table, there are people in communities that can bring them to the table, right? And so finding those people who are natural leaders and helping to support them in their efforts to bring impacted folks in, and also helping them to have access to the resources to deliver to those folks. I don't really, it's hard for me to think through the other piece in a neighborhood context that you mentioned, having people who are disaffected, care about the things that other folks might be going through. In the neighborhoods I represent, violence is happening in very tight geographies, and so there are direct victims, but there are also people who are just traumatized by being in the area, even if they're not. And it's important to bring those folks to the table as well and have them feel like they're a part of in directing the solution. So I think it takes time, patience, identifying those at-risk people, identifying the leaders who can reach the most at-risk people, and making sure that they're supported in doing their work. So those are just some of the ideas that I have.
We have one down here. Adrian.
So it's something that I've been struck by listening to all of the panels throughout the day, is that although, you know, the speakers have presented on so many different issues, there's, you know, some really strong common themes. And that's around, you know, what solutions and the sort of the process and the framework. And so my question is, when there are common goals such as decarceration and not over policing and community engagement, if anyone has thoughts on sort of how we can build partnerships and connections sort of across different topics where maybe some of the goals are similar or even just lessons learned and things like that.
Put it all on National League of Cities and the council member, but you know that framework seems to invite a process of cutting across lines and changing how we think of problems.
Yeah, I was gonna, so we've developed a framework about how to think differently about measuring what safety means, with some, which would involve and kind of cross-sector, cross-city approaches to safety. So you can't measure safety differently with the same players. So I think that's one way in which we could get at a cross-system approach, so that if we're talking about public health, public safety, education, there's probably transportation, all these things are all interrelated. And that part about balancing roles and creating a framework involves, you know, you can't just keep the siloed work. And that's something that we've been encouraging cities to kind of break out of those silos. I think they're so deep and have very big roles. So it takes some time, but some cities are, I think this past year, as Marissa talked about earlier in the presentation, cities realize that they can't just keep doing the same thing and that there has to be some of that processing work. I don't know if you have any additional thoughts.
I think it's a very vital point. I think we have to figure out how to connect this work if we're going to be successful. I think we're starting down this path in Philadelphia. Here we have a woman, Erica Atwood, she leads the criminal justice and public safety cluster. So there's a recognition that all of these things kind of are interrelated, and our strategies towards them have to be interrelated. But I still think we have to do a better job at connecting the dots. So for example, in some of our hearings in council last year, where we were looking at gun violence, it stuck out to me that a high percentage of the folks who were shot were folks who were on probation. So what are we not doing to appropriately support people as they're coming out, as they're getting back into communities? If we can figure that out, that'll help us in a big way in addressing gun violence in the city. But we haven't gotten there yet, even though we're starting down the path. And I think getting there will take a bigger commitment to this work than we've formally been willing to make. We've been very willing in Philadelphia and many other cities to invest millions of dollars in enforcement. We've been less willing to think about the supportive and preventative services that could stop gun violence and help with other things like decarceration and some of our other.
Jorge, I would just like to bring you into this.
Well, I had a response. Yeah. Thank you very much. So just to offer some points on that question. I think, reform movements have been incredibly persistent, and the issues we're dealing with now are not new to us or our generation, right? I mean, again, these are cross-generational efforts that have persisted over time. But I think one limitation or one vulnerability is that they're often galvanized around discrete political moments, right? So George Floyd's murder last year is what really set off the reform movement of 2020. And then something happens that causes the pendulum to start swinging the other way. And I think, connected to George Floyd in Minneapolis, the vote in Minneapolis on election day to not disband its police department and replace it with the Department of Public Safety is viewed by many to be kind of like a motion point to pivot into another direction. And I think a lot of what can cause hesitation or an inability to create broad coalitions is the fact that, perhaps the decarceration movement doesn't want to be affected by the setbacks of the police reform movement. So even though there's an alignment of interest there, there's a recognition that, what happens in one could have a ripple effect in the other, and do you really want to assume that on your shoulders? Now, I will say about the Minneapolis vote is that I personally don't think that it's as much of a setback as a lot of the rhetoric which leads you to believe. I read a lot of op-eds, the day after the vote that said, police department is dead, look what happened in Minneapolis. And that's an incredibly simplistic view. I think both the persistence of the police reform movement, but it's also a really simplistic view of what actually happened in Minneapolis. Because if you first of all look at the vote was 56 to 44 on a public referendum over whether or not to disband the police department and replace it with the Department of Public Safety. Not an overwhelming mandate against, reforming the police department. And if you look at the question that was posed to the voters and the actual proposal itself, it basically said, do you want us to replace the police department with the Department of Public Safety? And by the way, we'll fill in the details later. So the rejection of the proposal, I think, had little to do with the merits of doing that. It had to do with the fact that I think it was lazy policy. Again, my critical critique is about policymaking. This is a component of it. It was just very lazy, I think, on the part of political leaders in Minneapolis, where they experienced this last year too, when they had the Minneapolis City Council vote back in June to say we're disbanding our police department, but without any specifics, which caused them to rescind their vote by the end of the year and then put it to a referendum that basically presented the exact same question that they had confronted in June, without any real further development. And given all of the attention that's been put on this issue from the moment that George Floyd was killed to the election year of this year, you would have expected something more, especially in Minneapolis, which served really as the epicenter for the movement of the last 18 months. So I think to answer the question that you posed about the prospects for coalition building and things like that, I think there are a lot of prospects for coalition building. I think that there's a huge alignment of values and goals. But we just need to really figure out our political strategy in a way that doesn't cause one part of the coalition's defeat, or ostensible defeat to impact another, especially when these can be really avoided.
Jorge, I would love if I could get you to talk about a different aspect of this issue, because I think you were the person today who really emphasized the importance of finding a way to grapple with the organizational level, organizational decisions. And, even on this panel, when we think about the National League of Cities idea and what we might do here in Philadelphia, we got to get licenses and inspections involved here. We have to get better practice on the ground. We're talking about the probation department and the decisions that the probation officers make. We're going to talk about, probably the school board and, several other city agencies, and then the private system. I mean, we got landlords who run, their business on a steady diet of $99 evictions. And we got to get them to change their business model, those operational decisions. So from that perspective, do you have a sense of a way forward to get, how we can start to be more aware of that, and also ways, you have some examples of ways that advocates and city, politicians are successfully grappling with that second layer of operational, work?
Yeah, I mean, I think the answer to your first question, in terms of what we can do is to, again, be cognizant of it, to really pay attention to it. I think a lot of political movements in particular have a really good idea of what this big picture is, but we're not really great on the details, and it's where the details matter. And I'm sure the council member has experienced this herself, but when you're actually in the business of policy making, you are slapped in the face with minutia over procedure, minutia over state laws. And we had a presentation earlier about preemption, which again, for those of us who were lawyers and were law students at one point in our life, we probably tuned out a lot of that conversation because we're just like, this is so dry and boring. And yet it's the thing that's actually impacting the real world and real world prospects for achieving change. So just being cognizant about it and giving due attention to it, I think, is the first major step that we can take. I often mention to my students, I harken back to the old Schoolhouse Rock jingles about, how a bill becomes law and how we don't have that anymore, right? Nobody knows how a bill becomes law anymore. We just don't have the education of that, even in the form of Schoolhouse Rock. And we really need to revamp that education. Especially for those who want to get involved in this. I mean, I sorry for all the critiques. I don't need to be such a gadfly, but one other critique I have is that, again, we're really ignorant about the mechanics of how to make these things happen in real life, right? So even when we agree on the goals, we just don't have a fundamental understanding of the processes to see them through. So even on something like defund, for example, and there is no universal definition of defund, so take for it what it means to you in your mind. But if we're accepting that defund as a central component includes taking money from the police department and reinvesting it somewhere else, does anyone actually know how to do that? I mean, the answer is really complicated, and it's not as easy as saying, okay, well, I'm going to reduce the police budget by half and then reallocate that money somewhere else, because that's not how public financing works. I mean, if you have a dedicated funding stream from the federal government, for example, that says you can only use it for this one thing, you can decline the money and say, okay, we're defunding our police department in that respect by declining that money, but that doesn't automatically free up that money to be used elsewhere. It goes back to the federal government to be used, again, for the specific reason that it was allocated for in the first place. If you may have, obligations to pay pensions, for example, for police department. So all of the money that you may have that could be discretionary in nature is already committed to something that to an obligation that you can't just, go back on. So I think in terms of what we can do, I know your question was about decision making, but it really is just a broader question about understanding the minutiae and the mechanics of how all of this works, whether it's decision making or whether it's policy making, and realizing the limitations and importance of each. That's, I think, kind of the greatest thing we can do for ourselves to improve the prospects of achieving any of the changes that we've discussed today.
Well, we're coming to the end of our time, but I want to see if there's anybody on the panel who has something else they want to say before we wind up. Well, then I want to declare this meeting a success and hand it over to our team.
I really enjoyed this, and I think I enjoyed it even more because I didn't moderate it. Sorry. But thank you for going ahead and getting started. So thank you all for attending. Thank you for attending virtually. Thank you for speaking. And again, thank you to the law review, especially Pooja and Sarah and Bethany Saxon for making all of this happen.